Again, I'm Mary Gerisch from the Vermont Workers Center, and I'm so pleased to be here today so that I can talk with all of you folks about how your people here in Oregon can build a movement for universal health care, just like the people of Vermont did. And there are a lot of ways that we can do it. And a lot of people say, well, and actually I used to be one of these. I was really disillusioned 10 or 12 years ago, said, what can one person do? Because, you know, the balance of power is such that we have people with lots of money and lots of influence over here, insurance companies, big businesses, and I don't have much money at all or much influence. So it felt like I was really disempowered to do anything about it. And then I learned that it is possible to shift that balance of power. And it's kind of like, if you think about a teeter-totter, and when you're little, and I actually did do this to my brother, not a lot, but he's younger and was smaller, now he's not smaller, but he was smaller at the time. So, you know, put him on the teeter-totter, I get on the other end, he's up in the air, right? It's not a lot of fun for him, so I didn't do it a lot, but that's where I am when I want to protest what's going on with the healthcare system, because the insurance companies and the lobbyists and the people with big money and influence are on that end of the teeter-totter, and I'm way up there in the air, and I can jump and yell and scream as loud as I want and as hard as I can, nothing. But if I get a couple hundred people on that teeter-totter with me, it starts moving just a little bit. When I get a couple thousand, all of a sudden we're getting a little bit more of a balance. And when I get many thousands, guess who's up in the air now? And it's not the people. And that is really the only way that Vermont was able to shift the balance of power and achieve what they told us wasn't politically possible, by bringing all the people of Vermont together, because our government is by the people and for the people. So that means we not only elect our legislators, but they work for us, because they're working for the people, not the other way around. The people, if we stand together, can remind them of that, because they always have to get reelected. And although big business and insurance companies and lobbyists are really good at giving them perks and trying to marshal all their forces against them, it's the voters that are going to control who gets in there. So for the first year of our Healthcare as a Human Right campaign, Vermont went about building a base of people, everybody, all kinds of people. Didn't matter your economic status, it didn't matter how educated you were, just all the people of Vermont, because those are all the voters. So in order to get everybody together, because you know that our opponents are always using anything they can to divide us. That's because they know very well that if the people get together, they might be able to tip that balance of power. So anything that is divisive, whether it's cultural or ethnic or racial or socioeconomic, they will seize on that and try and get us to argue with each other, because if we're arguing with each other, we're too distracted to come together and change things for them. So the human rights framework worked very well to unify people. And I think the real key here is the word human, because we all are human. And we all live in a society or a community. And we know very well that we need each other to live, or we wouldn't be living in a community. We all contribute different things. We all have different strengths and weaknesses. And for example, in Tibet, there are monks whose only possession is an empty bowl. And they have to go around in the community and go to people's door every day and hold out their bowl, because that's the only way they can eat. And the people put food in the bowl, and then they go to the next house and hold out the bowl, and somebody puts food in the bowl. And this serves a really valuable purpose, which is not just to keep the monks from starving to death, but it's to let the community know and remind the community that we all need each other to live. And we all know that, but sometimes it's easy to lose sight of. So the human rights framework that brought this grassroots organization of thousands of people together is empowering for people because it's very simple in its 5 principles. And they're really easy for everybody to understand and to talk to all their friends, relatives, and neighbors about, no matter whether they are well educated or can't read. And the first principle is universality. And what that means is, if you're a human, you get it. Everybody in, nobody out. So there's really no argument about which humans should get it, because we're all humans and we all get it. And that's just it. We all are standing together saying it's a human right. We all need health care. The second principle is equity, which is a lot different than what we usually think of equity as meaning, because it doesn't mean we all get the same. And it doesn't mean that, that there's inequality or a fairness involved. What it means is that each one of us gets what we need when we need it. And that really only makes sense because you're going to need something different than you're going to need something different than you're going to need, I need something different than you need. And particularly in the instance of health, it's really important that we get what we need, not what somebody else needs. I don't need your checkup schedule any more than you need mine. So equity of access is the second part, the first part of the second principle. The second part of the second principle, which is also equity, is equity of financing, so that people pay according to their ability. Because everybody that's human, that is a resident of Vermont, not a citizen, but a resident of Vermont, is included in this pool. And so everybody's going to pay according to their ability. The next principle is accountability. And this really goes back to our constitutional and democratic roots, because this says, yes, it is a government by the people and for the people, and the government works for us, and they need to answer for us. So we're the people, and we get to hold our legislators accountable for what they're doing or not doing. And we get to hold the health system that we're a part of accountable for whether it's meeting our needs or not. And the next principle is transparency, which is just what it sounds like. It's easy to see what our system is and how it operates. We don't have closed-door meetings. You don't need special combinations to get to certain benefits. It's all very clear, and it functions that way. And the principle after that, the final one, which is really important, is participation, which is that we are the people, and we get to participate and tell our government what they need to do for us. So these principles are really hard to argue with for anybody. Because if somebody says, well, I don't think that everybody, I don't agree with universal health care. And if you say, well, so you don't think everybody should have health care? And let's say they say, no, I don't. And then you say, so which one of your neighbors or friends or relatives would you choose not to have health care? And I've never known anybody that could answer that question.